Hi, my name is Dr. Rupa Chilvers. I'm the Deputy Director at the Bevan Commission. This information briefing is about the Cancer Innovation and Improvement Programme brought to you with the Wales Cancer Network, innovation leads and partners across Wales. We're excited to be able to work with everyone on this programme. I will be supporting the application process, joining the panel, and also supporting the programme as it goes forward. In this information briefing, we will be giving you an overview of the programme, how the application process works, and the eligibility criteria, covering some of the frequently asked questions that you've sent to us. I hope you are able to get as much information from this as possible, but even if you can't, please do get in touch with us. If you have an idea that you're not sure whether it will work or not for this programme, please do get in touch. We would love to hear from you. And now I'll hand over to Claire Birchall and Tom Crosby for the rest of the information briefing.
Hi, my name is Claire Birchall and I'm the manager of the Wales Cancer Network. We lead a number of programmes, all of which are underpinned by research, development and innovation. And this particular fund is one that's very close to my heart in terms of really transforming the way that we deliver care going forward to improve outcomes and experience for patients who are going through a cancer diagnosis. I will be part of the support aspect of this fund and also part of the panel to judge the allocations of this fund, and I'm really looking forward to the successes that this project should bring.
Hi there, I'm Tom Crosby. I'm a consultant oncologist. I'm National Cancer Clinical Director for Wales and effectively one of the clinical leads in the Cancer Network. And I'm really looking forward to being part of the panel that looks at the applications that we're going to receive.
So Tom, tell us a little bit about why these projects are important right now, and Claire, if you could follow after Tom as well.
So I think it's really clear that for many years we've been focusing on trying to improve cancer outcomes in Wales, and I think we were beginning in the last couple of years to focus on those right areas, about intervening earlier, about trying to prevent cancers where possible, but where they did occur, trying to get patients to present in a timely way and diagnose those cancers at an earlier stage where we know the outcomes are better. But unfortunately, as everybody be aware, the pandemic has happened, and that's put a lot of pressure on the system, which was already fragile. We knew we didn't have the cancer outcomes that we wanted in Wales compared to similarly developed countries and jurisdictions around the world. But the pandemic has put even more pressure on those systems, and people will be aware that there's a general weariness around that the workforce are tired. But at the same time, when there is greater pressure on the system, when we are looking to redesign some of those service models, we think it's more important than ever to look at improvement in innovation, at ways that we can work differently, be that through incremental gains in the way we practice, or more transformative measures. We are aware that even doing those things when people are struggling to maintain the capacity in the system to try to meet the demand that's coming forward is a major challenge. But what we can do is offer support to those individuals and teams to work with us and explore ways of working differently. So we're really looking forward to that as an opportunity.
I think it's a really important time at the moment because the last year, 18 months has been incredibly challenging for healthcare partners, third sector support in terms of support in any sort of headspace for innovation or improvement. And as Tom mentioned, we've got a track record of wanting to change how we deliver cancer services outcomes, always improving in terms of the work that we're doing. But I think now more than ever, these teams need that support, that wraparound and that headspace to be able to do that work. And through this programme, what we want to try and do is offer that wraparound programme to pick out those ideas that individuals may have as a result of improvements or changes through COVID, or have had for some time but have never had the opportunity to either share those ideas or the support around them to turn those ideas into potential innovations. So I think it's really now time for us as a network to provide with our partners in Bevan and Life Sciences to support that work. Now, this won't just be about allocation of funding, which sometimes is a constraint to people's ideas or the ability to get those ideas off the ground, but it's also about quite specific, bespoke type of help that sometimes health and public sector, sometimes third sector, don't get that opportunity to have as a gift to work alongside them in these sort of projects. So that's what we're trying to do with this piece of work, is to not only sponsor people to think in a different way, to try and think more in a more partnership, scaled up sort of way, so that those little ideas can become big innovations that can be shared across sectors and across Wales, but also to have that support alongside them to overcome any obstacles or hurdles that maybe they've come across in the past, or even to improve their skills, their confidence, or the message, the communication that they need to get across to get those ideas over the line, and really being able to see that longer term impact on either patient outcomes, patient experience, or services efficiency and ability to work in a smarter way.
So Claire, can you say a little bit about what we're focusing on as part of the cancer pathway for this programme?
So one of the areas that we were really keen to focus on as part of this work was to look at the early part of the pathway, partly for some of the reasons that Tom shared, but also we know that it's a very anxious time for patients, both in terms of initially seeking that first contact and that first bit of support and having the confidence to go and take forward sort of red flag symptoms. But then that early part of waiting for their first contact, waiting for that first diagnostic, and then waiting for the outcome of that diagnostic or referral onto another diagnostic, where that time frame can be quite elongated in terms of waiting time. We also know that's an area that generates an awful lot of anxiety, but an awful lot of complaints around people not being able to get the communication or the access to the services at a time when they really don't know if they have or they haven't got cancer and what's ahead of them. You know, most of the time our experience is when we have a diagnosis of cancer, we tend to be able to respond from a treatment perspective in a more timely way than the earlier part of the pathway. One of the areas that has been absolutely decimated through COVID has been that earlier part of the pathway, either waiting for the time for the referral to be prioritised, first outpatient appointment, or access to that diagnostic. And some of the data that the delivery unit have shown us shows us the amount of patients that are stuck in that part of our whole pathway, and then how that will shift from the early stages of outpatients to diagnostic and just cause a constraint further along the pathway. So that was one of the areas that we were keen to focus this on. We also know that late diagnosis obviously can lead to poor patient outcome as well. So that was the driver for this, really. We also know that some of the learning we've had in previous rounds of innovation or work that health boards have done is that there is a lot of opportunity to modernise that part of the pathway, either through new ways of working, through new roles, through new technology, or new ways of working with patients around empowering them and involving them in their care and co-producing their care. So I think that was a real opportunity for us, and allowed us to produce the guidance which will direct people's thinking maybe around where we could potentially make the biggest impact into an area which needs significant attention.
Thanks, Claire. And over to you, Tom. So who should be applying or thinking about applying for this programme?
So we're really interested in hearing from healthcare professionals who are working across the pathway and across the geography of Wales, and across organisations and other sort of stakeholders. We do want the lead applicant to be employed by the NHS, but we're very happy to work with partnerships with those people who might be working with other sectors, be it the third sector, the HEIs and industry. And I think it may be people with innovative ideas, or it may be people who have started a piece of work and need greater support. So I think we're trying to focus on those parts of the pathway where we think we can make the most difference, and both difference in terms of benefit to the applicant, but also ultimately benefits in terms of patient outcomes, which is why we're focusing on the early stages of the pathway, encouraging people to come forward, awareness of signs and symptoms by professionals, be in primary or secondary care, or improving the technology or the efficiency of how that diagnostic pathway works. We're very interested in ideas that can be scaled up across organisational boundaries and can be adopted by the wider NHS within a reasonable time frame.
Thanks, Tom. So, Claire, people have been asking us how this works for approval at health board level or in their organisations. Can you give us some information about this and how it would work for the programme application?
So as part of this programme, we are really keen to support the applicants and the teams going forward, so that this really does stand the greatest chance of making the biggest impact, the quickest impact, but also a sustainable change, which will help patient outcomes and experience. So the programme is designed to wrap as much support around the individuals and the teams with the organisations that are in partnership with us here in terms of launching and supporting this ongoing programme. But we also know that it is a time when our health board teams are really up against it. So we're heading into the winter. We are not out of the woods with COVID, and we've got a significant recovery agenda, and that's just in the acute sectors of our organisations. We've obviously got significant impact on primary care and on our community care and social care services. So everybody is exhausted post-pandemic, and everybody has got a million and one priorities. So it's really important that our teams are supported by their organisations, and as such, we have asked as part of this application for line managers to give their full support and understand what that means in terms of the commitment to the project. But we've also asked for executive support and support from our innovation teams out in the house board. And the thinking behind that is to actually raise the profile of the work that these people are going to be leading on their behalf for their population and for their teams. And, you know, this is public money that we're using. It is spent within the jurisdiction of the Collaborative Chief Executives Group. So the executives do need to sponsor this and really throw their weight, commitment, support and challenge behind these projects so that they stand the greatest chance of making the biggest difference. And also then protecting those individuals and those teams to have that headspace and that time. And obviously there are some specific requirements around the teams and the applicants having to have time released to support the development sessions that are on offer to them through our colleagues.
So there's funding available as part of this programme, and Tom will give us a bit more information about how that will work.
So we're really excited to have negotiated a total fund of £100,000 to allocate to this really exciting venture. We don't want to be too prescriptive and restrict the proposals that come forward. We have learned with previous experience that a fewer number of larger projects have a more chance of achieving an impact. And we have looked roughly at funding a maximum of 5 projects. But whatever your ideas, we would like to hear from you. if you have alternative sources of money to fund some of these projects, we're happy to work with other partners. But ultimately, we want to hear from you with your ideas, and we will give you feedback on our thoughts regarding those.
This programme is designed to be a 4 to 12 month programme depending on the complexity of the project that is being supported. So there are expectations that sit alongside this in terms of completion, and Tom will give us a bit more information about that.
So I think a little message in terms of the expectation of the timelines of trying to make a difference. We have received sort of feedback that, you know, there is a desperate need at the moment to cope with some of the pressures we're sort of seeing in the system, and so we are looking for projects where the projects themselves can be completed and, importantly, evaluated within approximately a 12-month period of time. We do want that evaluation to be taken up so that we're able to test the changes that have been introduced, but also with a view to whether those changes could be applicable across the wider system. Now, what we're very happy to do is after the funding for the discrete project, to work with Bevan or other agencies to work with the applicants to see how we can adopt those changes that others would find beneficial across Wales.
So as part of the Bevan Commission support for this programme, we will be running the structured activities and also reporting on the progress that's being made. Claire is giving us a little bit more information here on how the tracking and reporting will work.
So in terms of reporting and feeding back and monitoring progress of these projects, it really depends on the nature of the project, the size, the scope, the duration. I think it's important that we get that fine balance between assuring that the governance around the milestones and outputs within the project and making sure we feed that in to our programmes so that we know progress is being made around the allocation. But not overcomplicating it and making it so structured that people feel as though they're continually feeding into templates and updating project plans. So I think there is that balance. I think the important thing to note is that we may have some fixed points where we have to have some formal feedback on progress, but there'll be lots of informal touch points for these projects because they'll have sort of known sponsors, they'll have their local innovation leads and their local executive support teams, but there'll also be this wraparound from Bevan, from life sciences, from some of the national improvement agencies that will help us with this, as well as obviously their local improvement leads. So we wouldn't want to be we wouldn't want to dictate the periods at which we would get feedback. I think it can be a bit more bespoke as long as we've got that audit trail and that governance throughout the project plan that they are delivering what we hope they would deliver, and if they are going off track, that they've got that support around them to pull them back and maybe refocus the objectives slightly.
So the application form is available online. It has been kept as simple as possible, but we are here to help, aren't we, Claire?
We recognise that sometimes putting forward ideas for projects like this can be really quite daunting, and we've tried to be reasonably prescriptive as part of the communication of this fund, so that people can see the kind of things that we're looking for. But we equally don't want to frighten people off with really clear exclusion and inclusion criteria. So we would very much want people to come forward and ask us ahead of the submission time if their plans or their ideas are suitable, and for some guidance on working up some of these proposals. Not a lot of people have got this expertise or experience of having done this before, and we don't want people to leave it too late to get their advice, and they then have maybe applications that aren't quite worked up in the way that they would stand the most chance. So as part of this communication and launch, we would definitely offer almost a discussion group, really, where people can come forward with ideas or even half work through bids, so that we can give you a little bit of guidance around what else may need to go in, and maybe give you the confidence that actually this is the right route for testing out that plan. So we really want to have early conversations with you. So please read the guidance that's come out with this launch, and do come forward to us for some support, and ask us questions around whether your ideas really fit the bill, and we will definitely give you that support and take your bids forward with you to the panel.
So thank you for listening to the information briefing. If you require any more information or have questions, please do contact us. And there are more information through the guidance that is available online. There's also a draft Word document that you can use as part of shaping up your application. We recommend that you do most of your work there and then put it across to the online form. If you have any problems with this, please get in touch. The deadline is 15th of October, and we look forward to hearing from you. Thank you.